All right. Thanks everyone for joining us this evening. Um, we have a lot of writing projects in line. So I've actually been putting the expert in the room on the back burner while we've got these drafts that we need to look at. So the first item of business, um, why don't we kind of go a little bit out of order, if you guys are okay with that? I want to give time to hopefully Colleen will be able to jump on, but I see that Sarah's on and Grace is on. Are you guys okay if we start with you with the seminars paper and just kind of give us an update of where you are with that?
Sorry, unmuting. Sure. Um, so, and Sarah, chime in if you want. We have started and have a rough draft right now. We have the intro, and then we're doing it based on the 5 R's of recycle, refuse, reuse, repurpose, and reduce. And certainly welcome anybody who would like to write. I think we have recycle taken, so but the others, we're looking for people to help us if interested. And basically talking about what each one is, giving some examples in real life of hospitals and the programs that they've implemented with each of these, and then things that pediatric surgeons can do.
Okay.
Um,
Who is doing the recycle one? Do you mind if I ask?
well, I had put it out to Ramin. I hadn't heard
Oh,
back yet.
okay, yeah. Good,
Yeah.
good, good. I was hoping that would be the one that he would do since he's got that big project with Trex. And then the reduce one, that's like, I mean, there's probably a lot of project ideas that could go under reduce, but like one of them would be like OR trays.
Yes.
Or,
Yep. Yep. With redoing the OR trays. Yep. That would be one example. Yep.
I was mentioning this to you, Grace, earlier, but Allison had reached out again to me. She was interested in sort of joining our subcommittee early on, but I don't think she ever got involved. So hopefully she'll be able to jump on board. I'm going to send an email out to Sarah and Grace after this meeting to connect you guys with Allison. She's a research resident. She basically took over Wynn's projects, I think, after Wynn finished. And she's working with Mahul and doing a lot of really great things. She's recently I saw had put out a couple of papers in 2024, and I remember the most recent one she put out was about reusing, collecting and reusing OR equipment. So if that fits with one of your R's, maybe that could be one that she would be able to take over.
Okay.
So which other R's are there?
Um, refuse, repurpose, and reduce are, and I think Rich was also interested in writing. Just waiting to hear back from him.
Oh, he's here.
Me, yes, I'm interested.
Okay.
1 hour ago, so hasn't had much time to respond from me.
Yeah.
Okay.
All right. So the deadline for that one is January 15th.
Mhm.
And I think we'll try to have one more meeting in the very beginning of January, but please let us know if you like need help or something.
Okay. Okay.
And I'm not sure how hard that deadline is. Marion has reached out to us just to make sure that we're on track and on board. But if we need a couple of days extension, we could give her a heads up.
Yeah. And we have the seminars is pretty strict about like how many pages,
Yeah.
examples of like, 17 references equals this many pages written.
Oh, I
And
didn't realize even the references. Okay.
yeah, so we're just gonna have to make sure we adhere to their margins and double spacing and everything else.
Got it. All right, perfect. Okay, so we went to everyone who just joined. Hello, and thanks for joining us tonight. It's been kind of a crazy night for a lot of people, I understand. So we went a little bit out of order. So I'm gonna go now to actually the perspectives paper. That's item number 2, trying to pedal for time for Colleen to sign on. So this one, Colleen, Chris, and I are working on it together. We're putting together a draft. I can show you guys where we are. Oh, looks like more people have been working on it. So we're putting together this. This is a perspective paper. It's geared for JPS, and our idea was to put this out along with our position statement. So like the position statement is what we are proposing that APSA will advocate for. And then the perspectives paper is kind of to bring attention to that and have it published in the journal. So so far we have an intro. So far we have a climate impact and environmental justice segment, which you can tell we are actively revising and editing, and we have a area referring to our APSA position statement. We've kind of massaged these around a little bit. I'm reflecting the 3 points that are on the position statement, which we'll talk about later on tonight. So these have kind of moved around a little bit as that position statement is changing. And then we're going to close with like a case for APSA to join the HHS pledge. But we'll see. Anyways, that's what we have so far. There's no deadline for this one, but we, like I said, want to have it ready together with the position statement. So I don't think we're quite ready for people to like go over it bit by bit as far as editing, because we're still kind of putting it all together. But maybe on our next meeting we can do that. Chris, do you have anything to add?
Yeah, I was just checking. Are you sharing that? Because I haven't seen it since I sent you the
Oh
draft.
my goodness, I'm sorry.
And-
I forgot to share screen.
And then it's okay because I at the same time I didn't know that you were sharing it widely, since that which is fine. But I just think that we didn't have a chance to sort of like tear it apart yet ourselves.
Yeah.
But as long as everybody's satisfied, I'm game.
Oh, here, this is what I was talking about. This is our draft that we're putting together. We have an intro section. We have a that's Chris's section on climate impact and environmental justice, and then we have a section on the APSA position statement, and then we're going to close with a appeal to sign on to the HSS pledge.
I did notice that in the agenda minutes you had mentioned that Tom Tracy had suggested that the APSA position statement needed to be a little bit more honed in and focused for children specific. And in reading that, I thought in the section that I did on the intersection, obviously, of environmental justice, there's a lot more that we could direct there. It might not be specific to U.S. children, but certainly global impact. If you feel that's an issue.
Yeah, I agree. I think that's a good way to he fell off. But no, I agree. I think that's a good way to hone that down. I think the position statement doesn't need to be quite as directed as the guidelines that Tom Tracy sent us, but I think it's a good idea to make it circle around children a little bit more. But we're still working on it.
Can you remind me what the HHS pledge is? Like, what does it say?
The Health and Human Services Pledge, it has multiple areas, but societies or institutions that sign on to it say that they will appoint like a environmental like lead. They need to count like their emissions, quantitate it in some way, and then have a goal of reducing those emissions by like 50% by year. I can't remember what the year was, but anyways, so you have to like have leadership position, you have to be counting your emissions, and then you set a goal on how much you're going to reduce it. And then for APSA, we had talked about that that was the one that looked at your financial investments, that your investments need to be in companies that also have like a green impact. So we had talked about it or addressed it tangentially at some of our prior meetings.
Got it.
What was the HHS pledge?
Just please consider that at some point the board may ask you, should we sign on to this? What would what would that look like for us in terms of how we would abide by this pledge? So that, like, what would be the actionable items that we would have to do in order to make sure that we actually abide by this?
Yeah. All right, we'll keep that in consideration. Okay, so
As far as that current draft work in progress, where is it currently? You sent that link earlier, and I got back to you during the day with some cases saying that I couldn't link onto that. Is it still someplace?
sorry about that. Originally, it was Colleen's creation. The creator for it is Colleen, so I think she'll need to share. But I did tell you, and I'm sorry about that. I did tell you that I was going to download it and send.
That's all right.
attachment.
Trust me. Listen, I know it's we've all been here. We're all there currently, and it's that time of year in particular. So my guess then is that if nobody else had access to it, that I would assume that it's Colleen or you that have been doing the editing of the 3 pieces thus far. That would be my guess.
You're correct on that.
Okay,
Yeah.
so so my
After
guess
you
is that
sent us your part, then
Yeah.
I added on my part, and then
yeah.
Colleen, I saw just from like this morning added on the intro. It's all been coming together like
all
real
good,
life.
but I'm thinking that others in the on the call might be like, "What the heck are they talking about?" But
Yeah, sorry, we weren't quite ready to share yet.
it's
but
all right. It's good.
we'll get there, yeah. Okay.
Work in progress.
At work in progress, yeah. Edit.
I think actually it'd be great for everybody once it's really written. It might be really. I think it would be really good to share widely with our committee, because where you might be limited with respect to the APSA position statement, and you need to be sort of focused and narrow. We might have some leeway. I think we will have some leeway with the prospective piece. And I think you can have some latitude. So. Sarah might have some great contributions from her experience and things she's working on, and Wen might have some very particular experience likewise, and others too. I don't mean to exclude people, obviously. So anyway,
I think when we publish it, we don't want to say that this is coming from the APSA OR Sustainability Subcommittee. I think I've been instructed, if I remember correctly, I've been instructed just to publish it as like a group of authors who are all interested in this issue, and that we propose that maybe something be done about it. So we welcome additional authors, I guess.
Yeah. Well, I mean, I think what's nice about it is it gives that opportunity because it's a detailed background in the 3 pieces that we've talked about. In fact, we said it was too thick, it was too deep, and we have to kind of thin it out. But I think what it does then is open up the opportunity to kind of share widely about like what people are doing successfully locally in their institution that others might be able to hijack and do at their institution, i.e. the whole very similar to the Expert in the Room series that you had started, right? I think that could come to life in this paper to somehow.
Okay. So next, I'm just going to keep moving down as we go. So the next item with JPS was the review paper, and that was with Sarah, Hannah, Sharmi, Ramin, Win. Oops, I have Sharmi listed twice. Does anybody want to talk about an update on that one?
I don't think that I'm aware of anyone has fully owned that one. I know JPS has published kind of 2 reviews in that topic over the past few years. And so something we could do if wanted. A number of us are working on not a formal review, but a partial review and commentary on the idea that pediatric surgeons and healthcare organizations could really be leading a lot of efforts in a carbon negative realm with all the innovation that has been done in surgery and pediatric surgery. I struggle a little bit with the fact that we're just still talking about sustainability rather than regenerative efforts. I know why we are. I think the fact that it's sustainability at all is amazing, but I think we could do so much more. And so it's a focus, it's making that argument and showing some examples. And so I think if wanted, that could be part of this. I just, in terms of doing kind of another review, I'm not sure how much that would add to what has already been published in GPS. That's new.
Yeah, I think originally it was Sharmi who was supposed to lead this review, or she had expressed interest, but she hasn't attended any of our last 2 meetings, so we've been tabling it each time. Anybody else heard anything else about it? Wynn, have you heard has anyone contacted you? Because I know you've like volunteered to like help out, but not lead.
Yeah, nothing super specific. I haven't seen any like actual pieces that have been written yet, I guess I should say.
Okay. I hear you, Sarah. I do feel like there's been a couple of reviews already out there talking about sustainability, and maybe that topic has been recently published and republished, but maybe something more about regenerative efforts could be like a newer topic, or that that we could do the review on, but we still need somebody to step up and lead it. Okay, I'm gonna put this, I'm gonna table this one until we get more interest in the review, because I feel like we've brought it up a couple of times and it hasn't had any forward momentum yet.
If we want to redirect to regeneration, I'm happy to lead it, but
You have a lot going on right now.
yes, always.
Oh,
I think for what it's worth, I would be in support of refocusing towards regeneration, and I'm happy to help with writing, Sarah.
I know you've mentioned it before, but I don't know if anyone else is clear on it. But what are like some differences between regenerative efforts and like sustainability efforts?
I think sustainability, it's trying to break even, trying to be net zero, or at least move towards that, where regeneration, it gives back. I know the terms kind of carbon negative and carbon positive have trouble, but an organization that kind of benefits the earth rather than compromising it or staying at kind of a neutral level.
So not carbon neutral, but carbon.
Carbon negative.
Okay. Is that something that we could do as pediatric surgeons?
Yeah.
Like what might be an example?
One of our research fellows is doing a formal lit review right now through some of the non-traditional databases to come up with some published examples. And I think they won't necessarily be in pediatric surgery, but they could be applied to it. And there's more and more discussion on a global health level that this could be done, and it's actually starting to be incorporated in some of the national surgical plans of other countries.
You don't want to scoop your research resident on the same topic. But I
Say that
guess
again.
I wouldn't want to scoop your research resident on the same topic, but I guess she's doing, or he or she is doing a review on not just for pediatric surgery, but for health.
Healthcare organizations, yeah.
Okay. So I guess we can come back to that at our next meeting. The next topic is about the I have so many typos. Toronto Star investigative reporting. I don't know that Annie is here. Let me see. No, Annie is not on, and Sharmi was leading that one, so I guess let's skip that one. Skip that. Okay, and we've already talked about the seminars in pediatric surgery. Colleen is not on yet, so Sarah, sorry, jumping back to you again. You have any updates with the GIGS Climate Justice Working Group?
No changes, no updates yet for that.
Okay. There was a survey that they were doing last time. Did and I think you were saying like if they finalize that survey that you we're going to send it to the subcommittee, then we could help complete the survey and give some responses back.
Yeah, the second phase after the board of directors input will be to the larger GICS community, and I think we can get feedback on that. It's just not there yet.
Okay. Okay, and then the ACS verification, I think you had mentioned that on an email to me about including a climate impact component.
Just trying to think about what could be done from a larger level policy standpoint. Like the verification process has this huge checklist of things that different centers need in order to qualify for level 1, 2, 3, etc. There's minimal in that on equity and nothing on climate change. And so one thing I was wondering, could we talk to them about including like a sustainability manager is one of the required components for a level 1 center, or some other area of focus relating to sustainability and climate change. I'm sure like I don't want to turn centers off of the verification process by including too many different things. And I know I live like in a fairy tale land at Seattle Children's with how easy it is to push these things through and how well they're supported. But it may be worth a conversation, depending what people think.
What do you guys think about that? Is that like the PIPS committee that you have when you're with the ACS verification? Like we're trying to get ACS verification here at Mount Sinai. So we're like really hyper focused on what our PIPS committee is looking at. And mainly what they're looking at are like, oh, our start times, like making sure that we have like a way to review complications and stuff like that. What other things do we? I'm not on the PIPS committee, so I can't say, but like, and I know these sort of things come up. But they seem like very basic, for like just how a hospital runs, rather than something like sustainability. But is that sort of like what you're talking about?
Yeah, like when you look at the document, it's a 100-page document that they update periodically. And for different centers, there need to be different resources, including like radiology, anesthesiology, yada, yada, yada. And the goal is to find, well, what Oldham did was to define Oldham et al. Optimal resources for delivery of pediatric surgical care. And I don't know this for sure, but I think having like a PIP subcommittee is a necessity for like a level 1, is my understanding, but I could be wrong in that. And so what if one of those resources had something to do with sustainability? To at least I don't think NSQIP at all is at the level of being able to include indicators related to the space stuff of how hard it has been to do equity stuff. But I think trying to get some level of focus in some way would be helpful. And it's been a year or so since I've read that document, so I could read it again to try to see where it may fit.
I think it would be challenging at its best. I think it's
Challenging and what? Sorry.
challenging at best. I mean, I think it's
Yeah.
a massive, broad stroke, and I certainly understand the visceral location from where it comes. But there's only about 45, maybe 50 freestanding children's hospitals, like Seattle Children's Hospitals in the country. And the majority of children receive their medical and surgical care in the other 162 children's hospitals that are part of larger academic medical centers. And even the largest academic medical centers are going to have challenging trying to meet sustainability targets. You know, I'm not trying to be the downer, just also being the realist about that. And, you know, the ACS level verification comes with some biting kind of feelings for the same reasons I just mentioned. You know, it's really, you know, what pediatric surgeon or what children's group wouldn't want to be a level 1 ACS verified center, right? And we all know that's not possible. So like adding something probably would make it even more difficult, you know, for centers to reach that level of verification, that wherever this equity and or sustainability got you know put in there. I think it's big, there's no doubt, but those are just my gut feelings.
It sounds like a sort of like the climate impact component, or having like a sustainability manager similar to like the HHS pledge, where they're like, you know, in leadership, you need to have somebody appointed to manage sustainability efforts. Is it kind of like that? I wonder, I don't think that the American College of Surgeons is signed on to the HHS pledge. I have to look back over the list, and I think it's an outdated list anyways, but I don't think that they are. But if they are, I mean, then it would make sense, you know, if the college is signed on to that, then you know, if that's what they, you know, believe is important, then including that in the verification, yes, it would make it more challenging for many centers that take care of children. But then you know, yeah, it just adds like another obstacle. But it may be that there are academic centers. I wouldn't say Mount Sinai is one of those for sure, but like maybe there's an academic center where they already have a sustainability officer, and then so for them that would not really be that much of a hurdle for this ACS verification, because they just kind of like jump onto that there's already like a sustainability officer for that.
But it's so much more than that. I don't want to be too hung up in this. I think it's a grand idea, no doubt. I really do. I think it's big vision, and I love it, and I'm all for that. Then the realist in me says, has anybody looked at their level 1 trauma program recently? Has anybody gone to TQIP in the past year? Because since the new book, the gray book for trauma, just using this as the conversation example, only 41% of ACS verified programs, level 1 programs, have gotten a 3-year review cycle of verification. Because the things have changed, the standards have changed, and the standards have changed in this case so much towards QI and PIPs and everything else. Nothing to do with patient care, as we all do, right? Because they've gotten so hardcore with that, only 41% of those that have gotten there. So that means that most of them, actually 44, I got a 3. I think most programs need to now renew again, obviously get things kind of in order, get re-examined and hopefully get re-verified. I don't know. Done this for a little while, and I can't help but think that there is a lot of tightening the screws on things that aren't necessarily improving patient care as much as we would hope that they would. And I don't want to be a downer there. I think this is a grand vision, but using the trauma and the TIPS example, I mean, the TQIP example kind of just immediately came to mind. I think a lot of hospitals are struggling to kind of reconcile sustainability as part of their mission anyway, let alone something as bold as you're suggesting.
Why don't I talk to Keith Oldham and see what his thoughts are? He's been one of my primary mentors, so I can just poke him. He'll be very blunt, as he always is.
Did he write like a paper about it, like a white paper about it?
He created the verification
Oh,
program.
I'm sorry. I thought he had written like a specific thing about the climate impact component.
No, he just climbs a bunch of mountains like Denali.
Oh, okay. I
I
misunderstood what you said.
assume he cares about the earth. I haven't actually discussed climate stuff with him.
All right, good. So, okay, let us know next time about what he says. That'd be interesting to know. Okay, so then the next part, I guess we're going to go back, and we want to show you guys our APSA position statements. We have a new improved version, which hopefully I will be able to find. I think this is the final version. Okay. I believe this is the final version. Let me put it on a view that you guys can look at, and then I will share my screen. Where's the share? There it is. Okay. Here. Okay. So we drafted this out before, and I think we shared it with everybody at our prior meeting, and we went over it. And then Colleen, very like last week, went over it again, and because she was looking at Tom Tracy's sort of guidelines on writing a position statement for APSA, and based on that, she wanted to make it more focused on particularly like pediatric surgery and what the appeal was from pediatric surgery like point of view. So it's been shortened. It's we've originally, oh no, this isn't it, because the shortened one she had only 3 points. Sorry guys, let me look to see where. Thought that one was it. Let's see. Okay. Right, that's it. Okay, so yeah, she had shortened it down to just 3 points. And basically, she looked at comments from Tom Tracy, and she needed to be much more focused on pediatric specific issues. So she tried to do that with this version. Okay, so just go over this. We're hoping that this will be our final draft that the committee as a whole will approve. And that's what we're presenting this to you guys as, okay? So I don't know. Do you guys want me to read it, or you want to read it yourself? Please. I think she sent it to everybody earlier too. Okay. Sorry, the silence is killing me, so I'm going to go ahead and read it out, and you guys can jump in wherever you feel like you want to put in an edit, okay? So climate change poses a significant and escalating threat to human health, with the impact expected to intensify as the climate crisis worsens. Unprecedented climate events such as extreme heat, flooding, and wildfires are already leading to rising rates of mental and physical illness, premature death, and health system disruptions. Children, especially infants and young children, are particularly vulnerable to the health impacts of climate change due to their unique physiology, biological characteristics, and ongoing growth and development. These vulnerabilities can have profound lifelong consequences. Healthcare, particularly surgical care, is a substantial contributor to climate change. The United States healthcare sector generates approximately 8.5% of national greenhouse gas emissions, with the majority stemming from its extensive supply chain. Beyond greenhouse gas emissions, the healthcare industry is also responsible for approximately 400,000 disability life-adjusted years lost annually due to pollution. In the US, inpatient hospitals rank as the third most energy-intensive type of commercial building and generates over 29 pounds of waste per hospital bed daily. Operating rooms are responsible for approximately 40 to 60% of healthcare organization supply costs, consume 3 to 6 times more energy per square foot than any other area of the hospital and produce approximately 30% of a facility's total waste. Surgeons, therefore, have a pivotal role to play in mitigating the healthcare sector's environmental footprint. This is especially true for pediatric surgeons whose patients are at increased risk of harm to physical and mental well-being from climate change, harms which may persist well into adulthood. Aligned with this mission of saving lifetimes, the American Pediatric Surgery Association acknowledges the urgent need to address the evolving climate crisis and endorse the following principles. Number one, there's broad scientific consensus that climate change is a consequence of human-associated greenhouse gas emissions that have been rising since the Industrial Revolution. Elevated levels of atmospheric carbon dioxide have intensified the greenhouse gas effect, resulting in higher global temperatures, sea level rise, more frequent extreme weather events, disruption to agricultural systems, biodiversity, and population displacement. Number two, these changes to the climate are already having detrimental effects on human health, which are expected to worsen as the climate crisis progresses. Okay. Children are especially vulnerable to the adverse health effects of climate change. These risks begin as early as the prenatal stage with maternal health heat exposure linked to preterm delivery and low birth weight, and extend through the critical periods of growth and development. Examples of climate change impacts on children's health included but are not limited to increased asthma exacerbations due to the extremes of temperature, increased pollen counts, increased mold and pollution, and increased exposure to wildlife smoke, mental illness, altered brain development, and disruption in cognitive development as a consequence of natural disasters. Temperature increases food insecurity, decreases access to green space and climate migration, atopic dermatitis and skin disorders due to increased air pollution, temperature, humidity, and poor nutrition, and increased risk of infection due to increased range and season of vector-borne illness. These and other medical effects can have lasting consequences, potentially affecting long-term health and quality of life. Furthermore, these effects have been found to disproportionately affect children from marginalized communities and lower social and economic strata. Pediatric surgeons have a unique responsibility on the environmental sustainability given the vulnerabilities of their patients. This work can start in the operating room, as this location in any hospital utilizes a disproportionate amount of supplies and energy and generates substantial waste. While patient safety must always remain the foremost priority in surgical care, the environmental impact of surgical practice should be a key consideration. To aid surgeons in this endeavor, full transparency of environmental impact reporting from the healthcare supply chain is essential. Furthermore, pediatric surgeons are essential members of the healthcare team and thus have an opportunity to encourage hospitals and healthcare systems to adopt policies that mitigate environmental impact by reducing greenhouse gas emissions and waste, that advocate for enhanced resilience in the face of increasing climate risk, and that do so in a just and equitable manner. Despite initiatives like the 2016 Paris Climate Health Agreement, global carbon emissions continue to rise. Even if drastic reduction in human-associated greenhouse gas emissions were to occur today, the climate changes that have already occurred will persist for decades. The lifelong health of today's children, as well as that of generations to come, is at risk from these changes. Pediatric surgeons in particular must recognize that the decisions they make for their patients have lifelong ramifications. APSA acknowledges climate change and its effects and endorses efforts and policies to protect planetary and thereby human health. Right, sorry, I was just reading that out to you guys, but anybody have any edits or just thoughts about that?
I'll start things off by saying that obviously it's a lot of work and it's nicely written. The the way that it's written, I mean, if I were to not have read it before, I would say you're essentially having APSA support that climate change is a problem
Yes, I
and
think,
essentially acknowledge the issue exists.
yes. Do we agree
Okay.
that we want to make that as a position statement?
I mean, I guess it depends on what your goals are with a position statement. Are you trying to move people in a way? I mean, quite honestly, the, the concept of climate change has been around for many years now, and one additional position statement is not sure that's going to change anyone's, thought process. I mean, who is the audience in this?
The other, like the pediatric surgery community in general, I would say, for one. Um,
I would dare say that those that don't believe in climate change will not be moved by this statement. In
mhm.
other words, if they haven't believed it up until now, I don't think this statement's going to change their mind.
Well, that's kind of like at least a baseline uh, tenet that needs to be established before we can even move to what we want to say, which is that, we believe that pediatric surgeons have a role to play in mitigating the effects of climate change. So that would be like our third point. But if you don't think that, climate change is caused by humans or that we have any role in that, then
I'm not debating that. I mean, I believe in it. Believe me, I believe in it. I'm just thinking in terms of who the audience is. In other words, those that already believe this will accept it, and those that don't will not be swayed by it.
mm. Anybody else have thoughts about Ken's concern?
My thought is it's less the audience and more that APSA is willing to say this matters, like their DEI statement, and then that as kind of a policy entity can be used in pushing other associated efforts forward. That's how I've kind of felt these are helpful with, but
But APSA doesn't do policies. Like we don't write.
no, if someone else said, all right, this is something that APSA cares about, and then that could be beneficial to those groups in moving other things forward, not necessarily APSA related.
Joanne had a comment.
Yeah, I have a question, I guess.
question.
Yeah, and Sarah answered a little bit. I was going to ask Ken if he was aware of other committees that had written position statements and I guess my question is, for Ken, how do position statements fit into the organization? Because I know when I tried to help this subgroup with this effort that they wanted to do, and I had some communication with Tom Tracy. Really, he was fairly helpful. I mean, he brought it back to the what do we call it, like the policy statements for the organization, which I forwarded to Linda, and really wanted it focused around individual children um, and their care and their outcomes. And so I guess two questions. One is how have other committees, if any, besides DEI, have written position statements, and how are those received? What do they seem to achieve? And then number two, how do they really frame it so that it speaks really to children as individual patients, so we could get a little bit broader support, for this.
The one that comes most to mind was one that I think we did a couple years ago, focused on abortion and how that um, tied into the Roe v. Wade being struck down. And at the time, there was a lot of discussions, and many different groups were making position statements at the time in order to declare, one way or the other, what was necessary. And I think we joined those efforts, and I think 3 committees joined in from APSA to help write and craft position statements. And so that took about 3 weeks to get done, because I think there was every other group, was putting something in there. So we put something together that went out and was on our website for a while. I don't honestly know what that resulted in. Not like it's not still an important matter, but these um, very important topics sometimes kind of come and go in waves. And abortion, again, not like it's not important, but now has kind of died down a little bit in terms of, what people are talking about. The issue hasn't gone away, but, APSA declared what, as an organization, we felt was important. In other words, choice, and making sure that, people had rights to choose. And that's where it went. APSA chooses to side with that. And, for this, again, I'm not against the statement. I'm just making sure that we have a target of what we're trying to say here. Saying that, climate change is a problem, that's very fair. I mean, there may not be sufficient papers that's kind of drill down to, things such as a planned reduction of greenhouse gases would result potentially in, less pediatric surgical issues. Like, I realize, not trying to minimize the issues that you've listed, asthma is important, all the things you've listed are important. But in terms of what is focused as a pediatric surgeon, would there be less, potential things that we would deal with? Would there be less, I'm making this up, like, would there be less appendicitis? I'm just like, things that we are potentially tied into, and things that we would be interested in as surgeons. Because, it's one thing to say, you could replace the words that, instead of surgeon, you could actually write down humans. Like, humans are responsible for this. Humans have, we should be tied into all this. Why should we as surgeons be particularly interested in this? Should the fact that we could change things in the operating room, yeah, that'd be one area that you can go after. I mean, ultimately, we have some control about what happens in hospitals. But
I mean, there's data that in areas of high pollution, is a higher incidence of congenital heart disease, birth
yeah,
defects, things like that. I mean, that might be a connector.
Prematurity.
Go ahead, Linda.
I was saying prematurity.
And prematurity. Yeah, I think emphasizing some of those aspects. And I was going to comment that also thinking about data that your group has, and how to now think more into working on policy on a larger scale. So not even, I mean, I'm not against working with APSA trying to get some type of position statement, but APSA is still a small group. And I would even consider helping you to think in a different way, like, for example, how we're working on injury prevention and learning how to regulate children's toys and whatnot. Maybe looking at areas of taking your data, your work, your information, and learning to take it to policy, like through Matt Mariani and people like that, which may actually accomplish your mission on a bigger scale and be maybe less frustrating and more successful. I'm wondering. You guys can give me some feedback on your thoughts on that. And I think your statement might need to be, I think it's kind of long too. I think it probably needs to be be edited a fair bit more.
As I wrote
Eventually,
to you, Linda, in the in that email with my draft, right? Again, I volunteered for that intersection of climate change and environmental injustice, right?
Mhm.
It's a crazy topic. It's like you what Joanne just said, we understand that. And I think APSA gets it too. Well, does one member care more than another member is probably the truth. The hard part is separating that. So there was no way for me to separate that, which is why the original drafts were so long, and I finally just honed it down to what I gave you. Because while it is true that, as you said, pollution affects congenital heart disease, perhaps prematurity, whatever else it is, you can't separate that from the associated environmental injustices that have occurred to marginalized populations over a period of time. Everything from, redlining and mortgage lending, discriminatory patterns, and so forth. And the more I tried to write that small little essay, the deeper I got into a hole that I was like, I'm not supposed to be here. Of course, I'm supposed to be here. We're human. We do this all the time. We're parents. We're surgeons. We take care of children. But man, it was really hard to get back up to, what I was really trying to say, which is a really easy statement, like Ken was saying. Climate change affects human health and disproportionately affects children's health and women in pregnancy more so than anybody else, and then marginalized communities, right? So that statement is a great statement because it really packs the punch. But I think it's just going to, I think people are going to turn away from it to some extent. I think some of us will be, yes, that's right. And then a lot of people are just going to turn away. They're going to be like, I like my gun. I'm allowed to have my gun. And it's okay that I have my gun, even if I'm in an organization that realizes that, we have to deal with injury prevention and gun control, et cetera. When that same thing happened, am I wrong, Ken? I mean, the same thing happened with the gun injury prevention sort of roundtables and editing and editing and editing. Like, how do you craft this to an organization where at least 50%, are firearm possessors?
Yeah, I mean, it's a good question. I mean, I'm not trying to reduce the excitement of the work. I just want to make sure that the goal of this is clear. Like if we are trying to figure out, we want APSA to support the concept of climate change, and then we should write
Yeah.
a fairly simple statement to say APSA believes that climate change is real and it affects kids, and we need to do something about it.
and
I
my
mean,
fear is that you will do so much work and then the leadership will not even want to like put it in the 2-minute turnover. And that's what I'm trying to kind of get at. And Ken is as well, I think, is trying to guide us to something that at least accomplishes, part of what you're wanting to accomplish.
Let's assume that's the final draft for the moment. Can we make a Reader's Digest version of that draft that becomes the final draft number 2 and see if you give them the shortened version, what the impact, what their take is on it? Like, will Tom look at that and go, this is a great statement. This is something we can stand behind?
Yeah, because
Or,
I think
hey, it's too thin. Can you beef it up? And you're like, oh yeah, hang on a second. Hold your beer. I got one right here, I just wonder where he is, because I do think that we're living in a funny world right now, and I'm not sure how people are going to grasp
Yeah, because I
long
think what
statements.
Ken said was like exactly what we wanted to say. Like point
Yeah.
one was that climate change is real, it affects children, and we ought to do something about it. It's like point 1, 2, 3. But I guess we
Mhm.
made it too long, and so we can shorten it so that it's a little bit more crisp and succinct. I know my thought is I hear you with the abortion um, position statement. I remember us going over that and like nitpicking like specific words and stuff like that. And you know, it came out, and we took a stance on that time when Roe v. Wade was overturned with Dobbs. But and then like you said, like the interest kind of died down for it. And I feel like for climate change, I worry that like with the new administration in 2025, that climate change will be something like a topic that's going to ramp up because of pullbacks, and it may become like more of a topic that people are talking about. And in that environment, like where it is more of like a hot topic issue, you know, I felt that, you know, APSA should make a stance on what they believe. And as far as like what is the point of the involvement of pediatric surgeons in this, I think it's because, you know, in healthcare makes a lot of greenhouse gas pollution, and in healthcare, surgeons' activities contribute to like 40 to 60% of that. So in hospitals, so you know,
And
we
who could
have
you
a big
collaborate?
fight.
Could you collaborate with any other group, Linda, to strengthen you know, your statement?
You would need really to, I think, go with the American College of Surgery. Because honestly, your point is correct. I mean, surgeons are responsible for a significant portion, but we as pediatric surgeons represent, what do you think, 3% of the surgeons in the country? I don't know. I don't know what the number is,
Yeah,
but it's not a large
the,
number, right?
the American College, but also like within APSA, what about any other committees? Like, is there like young younger professionals that might have more of a interest in this topic, or the professional committee, or just I'm just trying to think, or even DEI, like even if you could write it together with one or two other groups, it might strengthen it, it might focus it, or it might bring out some points we haven't thought of. Just
On the other hand, it might just complicate things. I mean,
that's true. Yeah, that's
I
true.
agree with Linda, and I agree with Ken. If we're trying to come up with a statement that apps or leadership is going to embrace about climate and the health effects, particularly on children, then we should just say that, be brief and to the point, have it come from this subcommittee of the health, you know, policy and advocacy larger committee, and see what they do with it. There's no reason that, you know, they don't like it, we revise it. But I don't know that necessarily getting more people involved simplifies it at all. I'm not against that, but I think it's a great statement. But I could see a bunch of people at APSA just not really cringing, but you can see them almost cringing, you know, like, oof, this is a bit much, you know.
Well, those are the same people that say APSA is too woke.
Yeah, but that's the reality, what we're dealing with, like everybody else is dealing with right now.
I'm with you.
Look, Michigan took, you know, think about what's going on at University of Michigan and how they're pulling back on even their DEI.
Sure.
Right? We are living in a really convoluted world right now that we didn't think we were necessarily going to be going into 5 years ago.
So let me just throw a what if. So let's say you end up with a statement that everyone's happy with in the committee. Let's say for whatever odd reason the board says, thank you for your great work. We're going to pass on this right now. Just for an instance. And so does that change any of the things that you're working on right now?
No.
No. So I would suggest that you come out with a deadline for yourself to say, as of January 2nd, wherever we are with this statement, we're good to go. We're going to present this to Tom Tracy and the board and ask to see if this could be something that the board would support. Because the longer you end up thinking about this, the more you actually waste time from the work that you really want to do, which I think is the papers you've just talked about, the policy statements that are going through AP, all the stuff that you're working on. Don't have this be the thing that is your rabbit hole. that you end up just spending 1,000 hours on and just end up with, okay, let's say they print it, and we can, pat ourselves in the back. But again, it still won't change the work you're going to end up doing. So I would say set a date and just let it go. If they accept it, they accept it. If they don't, say, at least we didn't waste more time. I would just get it done because
Okay.
papers, review articles, all these projects that you're working on are more important than this statement.
Okay. I mean, I agree with that, just setting a deadline and letting the board take a look at it. And our thought was, they would kick it back to us with like wow, that's a crazy idea. We don't even want to be a part of that.
I don't
Or,
think it's crazy, but the focus I think Tom is trying to do is tie this to pediatric surgical focus. And if you can, great. If there's not enough data that would suggest that it is, and I think you probably do have enough data, but it's like, okay, so where does that really leave us as an association? We can support it. Lots of other people have, but the question is, why hasn't the American College done something? I mean, if you have the American College say surgeons should look at this, then that becomes a bigger statement. Again, APSA is a small group in the big ocean of surgeons.
But if we're able to push a statement through our APSA leadership, would that give us a stronger position to then go to the American College and say, this subsection of surgeons has published this policy? Is there something that we can do as a larger community of surgeons?
Well,
Maybe that.
maybe it would have been easier when Henry Ford was the president. We don't have pediatric surgeons as the president of American College right now. That would have been a little easier. But it depends on what the focus of the American College is as well. They understand the political winds as well. And they have the focus on what's going on Capitol Hill, and they have finance reform that they have to figure out, and how much money's being cut and stuff. And their eyes on the ball of all surgeons making sure they get their money. And I don't know what the focus is right now, but I bet you it's everything to do with what's happening on as the administration switches over. And they may very well, in a few weeks, be pulling the country out of the Paris Accord. That's not going to help us.
But if they do, then I feel like it's even more important for a statement to come out. I mean,
It will not change what the current administration is going to do, I think. I mean, you would like that to be the effect, but again, let's be honest about how much we can actually do. I'm not trying to minimize what we can do, but this is not the right political environment to try to do a lot of that. That was 4 years ago. Sorry for the downer.
I hear you. I mean, I feel like I guess I just have a different perspective about it, because I feel like if the crosswinds are against you and it's something that you really care about, then it's even more important for you to stand up and talk about it rather than just to roll over and let that administration do whatever it's going to do, because we have to pick up after it.
And because of that statement, and because so many of us believe that statement, it should still be written, it should still be submitted, and whomever should have the opportunity to review it and agree or otherwise. And I think if they agree with it, there's your win. And if they don't, for whatever reason, I would ask why. Give me an answer, or give me an answer off the record privately or something like that. So at least that And then, but like Ken said, we're still going to continue to do the work that we feel obviously is important. And I think each institution has their own sort of version of what they can do,
Yeah.
So,
And I do agree, like, we don't want to sink too much time into this. We've got a lot of other things that we need to start talking about and working on. So I agree. Like, let's pick a time that once we reach that date, we'll go ahead and submit it. So what I'm hearing is this is not our final draft, it's not approved. And Colleen and I will continue to work on it and we'll send it to you guys again. And we may not talk about it like as in depth in one of these meetings. We may just ask you guys to like read over it and like let us know if you approve by email. Okay. Will that be all right with you guys?
Definitely.
Whatever you end up doing, I will support as much as I can on the board. Because I think that this is important work and I will definitely support what I can. We'll have to see, you know, what other board members think. I mean, I think they'll be supportive. I think that you have people that understand the importance of this work. Again, what that results in, I don't know, but hopefully it will result in a positive affirmation of the statement, which would be great. But I would be advising you to pick a date, get it revised, and get it in. And then it would be off your to-do list.
Yeah, perfect. Okay, we had, I'm going to end the meeting here. We already ran over. We had a couple of other things to talk about, especially the proposal for sustainability workshop at APSA. Mehul and Colleen are working on that together, but we'll talk about that in our next meeting. Okay. Thank you, everyone. Thanks for staying till the bitter end.
Happy holidays, everybody.
You too. Happy holidays.